Hello, I'm Catherine Kim, CEO and founder of Health Equity. I'm presenting our research project, a novel digital twin for chronic care coordination and healthy aging. The problem that we face is that 1/4 of U.S. adults have multiple chronic conditions, such as diabetes, hypertension, and hyperlipidemia, and these rates increase as the population ages. Uncontrolled chronic conditions are a strong risk factor for cognitive decline, and chronic conditions are associated with 3 trillion of US healthcare spend. That's 71% of our healthcare dollars. So we need to know how best to prioritize our investments in care coordination and chronic disease interventions that improve care and reduce impediments to healthy aging. Now, these represent a very large global market opportunity. Both care coordination and chronic disease management are projected to be about $20 billion by 2032. And we have a large number of potential customers here in the US, almost 6,000 federally qualified and rural health centers, and over 6,000 hospitals. While AI can help us with this problem, current analytic approaches are deficient. Machine learning and predictive algorithms that are built on limited data sets don't necessarily generalize past a single site. AI models are subject to model drift, and that makes our insights unreliable over time. A lack of real-world feedback from disparate sources limits how our models evolve. We have difficulty in simulating the impact of variables that are seen in real-world deployment on the trajectory of disease or treatment outcomes. And finally, we have challenges with explainability and validation of AI, which is really necessary for healthcare to trust it. Now, digital twins are a potential promising solution for this. A digital twin is a set of virtual information constructs that mimics a physical entity. So virtual twin can include both a mathematical or a mechanistic model. And those models are dynamically updated with data from the physical twin, and it predicts the physical twin's structure, context, or behavior. Now, these models rely on real-world data to generate real-world evidence, so they are human-centered AI tools. So Health Equity is trying to solve these challenges itself with a digital twin, which is an engine for simulating and validating longitudinal trajectories for optimizing chronic disease. Our future of digital twin as a service makes digital twins actionable for customers. So our digital twin seeks to predict how interventions like medication changes, health coaching, or remote monitoring affect the progression of chronic illness, prioritize when and to whom these interventions might be beneficial, and validate them with updated real-world data. Now we're leveraging data collected with our award-winning platform for digital care coordination and remote patient monitoring, which is wrapped around with an optimization toolkit. These data come from our previous customers in real-world settings. Our specific aims are 3. First, to use VAEs to develop a digital twin that has flexibility in trajectory generation and permits explainability of the trajectories. Aim 2 is to use large language models to develop digital twins and generate a wide range of realistic trajectories. And Aim 3 is to develop quantified metrics for initial validation and uncertainty of the models. The outcomes of our project are a set of longitudinal trajectories for chronic disease care for patients in rural and low-resource settings, a causal assessment of the digital twins with preliminary framing of a methodology for identifying those disease evolution trajectories. In addition, we'll deliver preliminary metrics for validation. And finally, a comparison of the different AI/ML approaches for developing digital twins with a set of metrics to quantify uncertainty. Our core research team is very experienced with many years of background in health informatics, data science, product development, and programming, in healthcare and care coordination, as well as in other regulated environments. We're supported by a world-class advisory team representing industry, AI, as well as healthcare settings. We hope you will join us on our journey to deliver real-world, data-driven decision-making to illuminate and prioritize interventions that improve chronic disease trajectories and healthy aging. Thank you.